Hello everyone, I'm Dr. Robert Bayer. I'm a medical oncologist and hematologist with Northwestern Medicine, and I'm coming to you live from the Living Well Cancer Resource Center, which is a wonderful organization that's supportive to all our cancer patients in the western suburbs now. You guys have expanded. So today's talk is what are the causes of cancer. I wanted to review basically carcinogenesis in a very short period of time. So I apologize to those that are looking for a list. This topic is huge, but I want to give you basically a 30,000-foot overview of the topic, and I think for your cancer survivors out there, it may give you a better understanding of how your disease developed. So I don't have PowerPoints, but I have a little prop, one of my children's toys, and I wanted to go over a little bit of the cell biology, since we'll be talking about that quite a bit. So in a eukaryotic cell, or a mammalian cell, or a human cell, there are surface proteins. We refer to them as receptors. Now in the land of COVID, you'll see people talk about spike proteins. These are surface proteins that interact with the environment around them. And so this is important for immune regulation and how the normal cells and cancer cells interact. Inside the cell, you have the nucleus. I just lost the mitochondria. I have the nucleus, which contains the DNA, the double helix, which is the program of life. It basically decides what the cell is going to be, what proteins will be expressed or not expressed, and when the cell replicates and how it replicates. And one of the problems with cancer is the loss of fidelity in the replication of the DNA. As the DNA copies itself, it makes mistakes. And when that leads to the development of cancer genes, then you have abnormal cell growth and abnormal development. The other parts of the cell, the Golgi apparatus, the mitochondria, mRNA, which is relevant to our vaccines, all of that are the mechanisms within the cell that allow it to function and grow. So today, I lost another mitochondria. Mitochondria are the source of energy within the cells. And interestingly enough, the mitochondria are not passed equally between mother and father. They actually come from the egg from the mother side. Luckily, there aren't too many cancers that involve the mitochondria, but muscle disorders, muscular dystrophy, are predominantly transmitted through mutated mitochondria. So anyway, getting back on topic, the cancer burden of the United States and of the world is huge. It varies between the first, second, and third most common causes of death in the world, depending on the country and the circumstances. COVID has really taken over our interest, and the statistics that I'm quoting are pre-COVID. In the modern developed world, cancer is the most common cause of death. In the United States, it runs neck and neck with heart disease and vascular disease and strokes. So it depends on the year and how you're counting the population. In the United States, cancer rate is approximately 40%. So that means 40% of the people that hear what I'm talking, or maybe higher, since this is a selective audience, will get cancer at some point in their lifetime. Men get more cancers than women. The good news is that the survivability of cancer has improved in our lifetime. while 1.8 million, give or take, people will come down with cancer in the United States every year, and this is based on 2-year-old data projections, only about 600,000 will die. That sounds like a large number, but there's been an improvement in the mortality rate for the major cancers in the United States of approximately 2% per year since 2000, which is remarkable considering the prevalence or how common cancers are. What makes the field of oncology and hematology difficult to study is the wide variety of cancers and malignancies. We're at the point that no one individual, no matter how much they study, no matter how good his memory, can know everything about all cancers. So cancer care, at least in this country, now requires a team approach and enormous resources. So the cost of cancer care is huge, but I'm not going to go into that today. Today we're going to focus on the why. So most of the references, most of this talk, the references are the National Cancer Institute, which you can access through cancer.gov. The American Cancer Society has an outstanding website with a lot of slides if you need PowerPoint, which I can't have today, and various other cancer center resources. Mayo Clinic, I already mentioned American Cancer Society. The SEER database is amazing. So this is a government database of surveillance, epidemiology, and end results. That's what SEER stands for. And that's the project that for the last 50 years has been collecting data on cancer, the prevalence, the incidence, how many cancers are there in your state, county, community, and country. The most common cancer in the United States right now outside of skin or non-melanoma skin is breast cancer. And just hit the top ones, breast cancer, lung cancer, prostate cancer, colon and rectal tumors, melanomas, bladder cancers, and lymphomas. If I've left your cancer out, it's because there are too many on the list. The main cause of cancer, you have to get back to my cellular model, has to do with mutations within the DNA. There was a professor back in the early 70s named Dr. Knudsen, who was studying retinoblastomas. These are cancers of the eye in children. And he postulated that there is no one thing that causes cancer, that you need multiple things to go wrong. And he postulated and backed this up mathematically that the retinoblastomas that we're seeing in children had to be due to a mutation within the cell's defense mechanisms against cancer and another mutation causing the cancer. So it's not just enough to be exposed to a cancer-causing chemical or environmental substance, but you also have to be predisposed to it. And that predisposition with a stimulation of cancer is called the two-hit model or theory of carcinogenesis. He actually went on to win the Lasker Award, which is the highest oncology award in the country, and pretty much this has been borne out in many theories, in many observations. The more modern therapies are theories of carcinogenesis are the multi-hit or multifactorial development of a cancer. So it can be up to 7 steps between the predisposition to a cancer and actually developing one. So when I talk about predisposition, it has to do with your own body's homeostasis and defense mechanisms. And we all have several layers of defense against cancer. At the molecular level, there are genes that you inherit that check the fidelity of replication of the DNA. And if there are defects in the replication of the DNA, when one cell turns into two, these cancer suppressor genes, if you will, cause the cells to become apoptotic or programmed cell death. They cause the cells to commit suicide because of these deleterious mutations. There are also immunologic defense mechanisms, which we've used successfully in the treatment of many cancers. So we can modify T cells, for example, to look and check the surface proteins and receptors on the surface of a cell to make sure they have the correct proteins. And if those proteins are mutated or false, then they will destroy the cell. There are antibodies that can latch on to certain cancerous proteins on the cell. And there are other, how shall I say, we talk about bacterial microenvironment. There are other immunostimulatory processes that can help defend and search out cancers. And we've been able to really use that as an augmentation to our armory of weapons against cancer. You'll know that nowadays there's not only surgery, but there's radiation, chemotherapy, immunotherapy, targeted therapy, transplants, CRISPR, CAR T therapy. We've basically augmented a lot of the natural defenses that our own body has. So that's a primer about this. I wanted to talk about carcinogenesis. And I have to pick up the pace here a little bit. So let's look at predisposition. Within predisposition, I talk about the familial cancers. One of the most famous being the breast and ovarian cancer syndrome. This was first discovered in the Ashkenazi Jewish population, but has now been identified in every ethnic group on the planet. And you'll come across these, the BRCA1 and BRCA2 mutations, breast cancer 1 and breast cancer 2. These are mutations, again, in cancer suppressor genes. They're integrally important in the DNA check system, especially how it relates to hormone balance and estrogen. And when these genes are mutated, either one or two copies, then they don't cause cancer, but you lose the natural first line of defense against a cancer. So cancers can develop at any age, but especially at younger ages if you're exposed to other things that promote cancer and promote further DNA mutation. Some of the more common cancer syndromes that we look for are the Lynch syndromes. Henry Lynch was a famous epidemiologist and cancer researcher who in the 1950s, by looking at the Amish and certain populations, was able to map out patterns of inheritance of colon cancer, endometrial cancer, and stomach cancer, and he postulated that there were genes that were being passed that predisposed to those cancers. 40 years plus later, researchers identified those genes, and we refer to those as microsatellite instability. And there are many of those in different variations, but if you don't have them, you're more prone to GI tumors and kidney tumors, and even breast cancers. So many times now when we see GI malignancies, stomach, pancreas, colon, rectum, endometrial, we will test for microsatellite instability, and if there are mutations, it turns out that the immune therapies the surveillance of the immune system, looking at the manifestations and mutations on the surface of the cell, have been incredibly effective. And I've had one patient with advanced prostate cancer, bladder cancer, and metastatic pancreas who has been alive for several years and is currently in remission because we've used a single agent immunotherapy to control his disease. However, the treatment's not curative, so we have to keep treating him in order to keep everything under control. So those are the brief touch on familial syndromes. Then next on the list is occupation. Many people that I see want to jump to workplace environment, that was the cause. Well, it's rare that there's any one thing. But yes, there are chemicals and there are occupational exposures. Famously, there were the women out of west side of Chicago and what was the name? It's the neighborhood that McNeil Hospital services, Berwyn. There were women there that worked in watch factories, and in the days prior to my age, they would put radioactive phosphorescent compounds on watch dials. You'll remember the pre-electronic watch days. You had a face and it would glow in the dark, and these were radioactive compounds. And in order to get the markings done perfectly, they would lick the tip of the brush and dip it in a radioactive paint, and then they developed cancer. There are people that develop mesothelioma from asbestos exposure. Diesel mechanics, it turns out diesel fumes can cause lung cancer. Aniline dye can cause bladder cancer. And that's why a lot of the old print press operators developed bladder cancers. Now those dyes are much safer, and fortunately we're not seeing those cancers. But the list goes on and on. Trichloroethane, which is an industrial solvent, and there are waterproofing agents. So it's not just the pesticides and the fertilizers, which you hear commonly in the news and on the internet. The list is just incredibly long. So the next is pharmaceuticals and herbs. A lot of people believe in natural products instead of pharmaceuticals, but I have to remind you that herbal products are chemicals. Many of the pharmaceuticals are extracted from herbs and plants. And so this belief that everything that's grown by a plant is benign is a fallacy. There are many organic compounds that are carcinogenic. The pharmaceutical industry has developed many of those into products we use in our daily lives. And many of the chemotherapies that I use to treat one cancer can cause another cancer. And so you have to weigh the risk-benefit whenever you deal with these chemicals and compounds. And then we have tobacco. The American Cancer Society has, in my opinion, done a real benefit to society by letting us understand the risks to tobacco. I've heard lectures where there are over 200 carcinogens in every cigarette. Some of the major ones besides nicotine are the aldehydes. There's actually arsenic within cigarette smoke. It gets into the plant through the soil, and then the tobacco leaves get into your cigarette, and you inhale that when you're smoking. I won't go into a lot of detail, but there's also formaldehyde and benzene within cigarette smoke. People are vaping. We don't know all the effects of vaping yet, but there is already data accumulating about lung disease, and there's research ongoing looking at the vaping and the risk of cancer. The problem is the funding for a lot of that research is limited. Obviously, when the government provides and funds cancer research, there's a greater focus on the people that actually have cancer because it's urgent that we figure out how to treat them. Then there's alcohol. If you drink a lot, part of your metabolism will result in the development of acetaldehydes, which are carcinogenic. So stomach and esophageal cancers and pancreas cancers are more common in those that drink regularly. Radiation exposure. Many people look to radiation and nuclear plants, but I have to tell you that the majority of radiation exposure is our sun. And so ultraviolet light and melanoma risk is well studied and well described. There are also tanning booths, depending on the frequency and intensity of the ultraviolet light, and there are natural substances. When companies mine uranium, they're mining it from the ground, and that will be in different environments, and we may not know it when we're walking on a field or ground that has uranium or radioactive products. When I was educating myself to, carcinogenesis within the suburbs that I practice, I found that there was a radium problem in the water supply for the Tri-City area. And then there's radon gas, which is odorless and tasteless, but is a very common cause of lung cancer in Illinois. And so I encourage you, especially if you have a well-insulated or recent construction house, to have it tested for radon. And if you can't afford it, the Illinois Department of Public Health can provide free radon kits if you can't afford them. Viruses. So HIV is famous for causing sarcomas, Kaposi sarcomas, and lymphomas, but the hepatitis viruses can also cause lymphomas and liver cancers. Cirrhosis from hepatitis is associated with primary liver cancers and can be quite deadly. So we now have screening programs in cirrhotic patients to try and detect that early before it metastasizes. Other viruses are the HPV viruses, which can cause oropharyngeal cancers, cervical cancers. There are certain serotypes because there are many different kinds of HPV. But what I find sad is in the United States, there's an anti-cancer vaccine that can prevent HPV-induced cancers. And there are studies that show it's effective, and in some states it's actually mandatory to receive, but not in all states, so that children of reproductive age should be vaccinated. And we're not doing a good job of that, and yet HPV-related cancers are becoming very commonplace. I have a partner that specializes in head and neck cancers, and the majority of head and neck cancers now in non-smokers are viral related. So outside of viruses, other carcinogens, your own hormones can betray you. Testicular cancer, prostate cancer, and androgens like testosterone have been linked. And in fact, the primary therapy of metastatic prostate cancer is to block down and suppress testosterone. In women, estrogen and breast cancer. Obesity. Obese patients have higher levels of estrogen, both in men and women, and they have higher levels of insulin-like growth factor, which can stimulate cancers and result in pancreas cancers. So obese patients are more prone to GI malignancies, pancreas cancers, breast cancers, we really aren't careful enough with our diets, myself included. Colon cancer may be a diet-related cancer, because if you look at the colon polyp rate and non-Lynch syndrome colorectal cancer patients, A disproportionate number of patients that eat meat-based diets get colorectal cancers compared to vegans. The colon polyp rate is much lower in vegans. There are also other inherited predispositions besides the Lynch syndrome. There are polyposis syndromes where people can make thousands of colon polyps, and those can become malignant. You can have inflammatory bowel disease like ulcerative colitis, Crohn's disease, celiac disease, which not only make your life miserable because of the chronic diarrheas and bleeding and the anemias, but also increase your risk of colon cancers, other GI tumors, and intestinal lymphomas. Let's see. Getting into the more obscure and less debated, sleep deprivation. I used to think it was very macho to be up all night, and when I was an intern, getting sleep was purely a luxury. And anything I could do to keep me going, coffee, peppermint oil on the gums, anything. My intern used to slap me to stay awake. But sleep deprivation, if you're not getting a good night's sleep, that can alter your circadian rhythm. There are two biologic clocks within everyone. There's one at the cellular level and one at the hormone level. And we talk a lot about melatonin, but melatonin is only part of the sleep picture. And chronic insomnia has been associated with an increased frequency of cancer, as high as a 40% increase in some populations of cancer. And then we have the microparticles. Dust particles, silica particles, sand particles that are less than 10 microns in size can get past our natural air filters, the hairs in our nose and the cilia within our respiratory tracts, which are responsible for cleaning out our lungs and airways. These particles can get past that, cause an inflammatory reaction within our lungs, and cause cancer. And so if you look at 9/11 first responders, the firemen and paramedics that were exposed to all that dust, of course there was also asbestos in the Twin Towers when they went down, but they were also exposed to fine particles. Many of them got severe restrictive lung disease, and if they survived the lung damage, then they went on to lung cancers. And so their mortality is much higher because of that dust exposure. There are studies that show people that work with fireworks, now that 4th of July is coming around and we all hope to be maskless by 4th of July. Many of the fireworks, those rockets, the propellant that isn't burnt off, leaves a shower of fine dust, and frequently that's less than 10 microns. And so if you're in that industry and inhaling those rocket dust clouds, that can predispose to cancer, and that can occur a decade later. Many of the professional rockets you'll see are actually mortars, and so those fireworks are not showering down minute particles the way backyard fireworks or illegal fireworks may be affecting your breathing. I'm way past my time, so at this point, why don't I take questions?
Nothing has come in thus far, Dr. Baer. However, we'll give everybody a minute to enter any questions they want in the comment section. I think a couple questions that maybe you could answer is, and this is probably very big and broad, but is mRNA going to have a role in treating cancers futuristically?
So mRNA, or messenger RNA, is critical in the transmission of the DNA message into the rest of the cell and then onto the surface of the cell. And mRNA is as it says in its name, messenger, that carries the sequence. We have mRNA vaccines for the first time that send a message to our cells, our immune cells, to actually make defenses against the spike proteins. Well, there's a lot of research going on to develop mRNA vaccines to make immune defenses against specific cancers. And so if you have cancers that run in families, you can vaccinate against those cancers. If you actually have one of those cancers, you may be able to use mRNA therapy in order to do a maintenance or a long-term suppressive therapy. So those things are all in development now and are extremely exciting.
One of the viewers wants to circle back about sleep deprivation, and you talked a little bit about how we have, the circadian rhythm. And so how does sleep deprivation increase a risk in cancer?
So the research on this is still, how shall I say, in the early stages. But within your biologic clock, there's a cellular, how shall I say, like a telomerase within the program of the DNA, and telomerase shortens over, how shall I say, over time, telomerase shortens the tail end of DNA and of chromosomes. Cancer cells have the ability to lengthen that time clock and become immortal. So one of the ways that cancer cells actually outlive your normal cells and reproduce faster is by changing the DNA clock so that it doesn't apply to them. The more common way, at least the theory as I understand it, is that if you're not sleeping, you have greater inflammation going on in your body and you have higher stress hormone levels. And this oxidative stress on your body damages a lot of your immune system and a lot of your chromosomes so that they're more prone to cancer mutations. The patients that are sleep deprived also have impaired immunity, and so their natural defenses are down. And so your ability to have your T cells attack and destroy mutated cells goes down. And in fact, in certain leukemias, you can see a variation in the number of natural killer cells and anti-leukemic cells depending on the time of day. Early in the morning and early afternoon, you may have more natural killer cells, and there's a whole field of cancer biology called chromotherapy where researchers have tried to develop what's the optimal time to infuse your chemotherapy drugs in order to maximize the attack against cancer.
Somebody else is asking, you could comment on the risk of cancer or illness from the calcification of the pineal gland, and does this have a role in sleep?
So are we talking, all right.
So, yeah.
So I'm
Calcification of the pineal gland, does that have any risk factors with cancer or illness?
So we're talking about the pineal gland in the brain and its relationship to malignancy. Calcification by itself is not malignant. We look for calcification in a lot of malignancies because as the cancer grows, it grows haphazardly, and if calcium is being laid down, it's not in an orderly manner. So that brings our attention to whatever organ. Breast is the most common one where we look for abnormal calcifications. But I have seen a cancer of the pineal gland, and it was horrendous. And we only picked it up because of size, but it did have abnormal calcifications. I'm not a specialist in neuro-oncology, so I can't tell you what the cancer rate is amongst pineal glands. But calcium metabolism is critical for cell growth, the communication between cells, and again, the biologic clock. The pineal gland is not the only timekeeper in the human body. Adrenal tissue will release cortisol, and there's a biurnal peaking and decrease to your cortisol. Sustained high cortisol levels will impair sleep because they are part of the fight-flight reaction and part of this chronic stress release that is deleterious to your immune system and is thought to be carcinogenic.
Good. Just two more questions. A viewer wrote in that her 23-year-old grandson is taking a hormone medication to help with hair growth, but this also obviously has some negative side effects, such as decreased sperm, and just long-term, this risk-benefit. Do you have thoughts on it?
So to my knowledge, those hair growth medications like minoxidil are not carcinogenic. However, they can affect blood pressure, and I can tell you I have a cousin that was on these medications, and while they work for a while, they eventually fail. So I don't think, in my readings, I have not come across anything that says compounds like minoxidil cause malignancy, but my bigger concern is, does he have, what is the cause of his hair loss? Does he have alopecia universalis, or does he have an autoimmune disorder that's causing the hair loss? Because 23, I believe, is what you said in the question, is very young to have hair loss. And some autoimmune disorders, like lupus and rheumatoid arthritis, are associated with cancer.
Another viewer wrote in, just making a comment, that they heard B17 stops cancer.
Peach pits. B17 has been debated to stop cancer for, let's see, how old am I? 60 plus? So pretty much my whole life, and has been studied in the United States, Canada, and Europe to death. And it has not been an effective therapy for cancer. I've had many patients get therapy. Laetrile was a common one down in Mexico. And of the patients I've personally cared for that got B17, not a single one of them is alive today. They've all died of their cancers. So I am a non-believer in it.
Last question. You talked about herbal products. What are your thoughts on essential oils? Because they're very predominant in the market today. Is it based on how it's being administered, how it's being utilized?
So actually, I spend most of my time out in DeKalb at the Kishwaukee Cancer Center, and we're actually currently studying essential oils in oncology patients getting chemotherapy. So I should clarify that the essential oils, as I know them, are not inhaled, smoked, vaped, or administered directly. These will be like almost like a room freshener type of situation where you have an infuser nearby. And there are reports that some of these essential oils have stimulated neutrophil function, which is beneficial in reducing infections, but we haven't been able to measure whether that change is clinically significant. So you may change the number, but will those neutrophils be more active, and will the end infection rate go down? Will the relaxation, for example, from the essential oils or the stimulation of energy reduce the cancer rate? I can tell you from the background on our clinical trial, there's insufficient data. But to my knowledge and readings, I have not come across anything that says those are carcinogenic, as long as you don't vape.
Well, thank you for that plug, Dr. Bayer, because we are going to be doing a talk on the trial you spoke of with essential oils. Do you have a couple more minutes? There's a couple more questions that came
Sure.
in. A viewer wrote in, there is a family history of cancer. Grandmother had breast, cousins have had lung and uterine and colon, and she's had breast. Would you say this means it runs in the family, and should other family members get tested prior to developing?
So the question, as I understand it, is if you have multiple cancers within the family, who should get tested? Is that a risk to you individually or to your children? So there are many different cancer syndromes. When in a prior employment, I was the chief of cancer genetics at Loyola University. And in the old days, more than 30 years ago, we had strict criteria over who should be tested. And you had to have multiple first-degree relatives. So if you had cancer, cancer family would come into play if mother or father had cancer and a brother and sister, but you had to have multi-first degree. Nowadays, we're not that restricted. As we test more people, we're finding that it can skip generations, that many people don't know the cancer history of the rest of their family because the family member may not want to share that information. And since most people survive their cancers, you may not know that an uncle or an aunt had cancer. So the short answer, which I'm rambling, the short answer to the question, should you be tested? If you're personally afflicted, then you should see a genetic counselor and be screened for testing. If the question becomes, who's the best person in a family that has a lot of cancer? Generally, it would be the youngest person to develop cancer within that family, because that's the person that mathematically is most likely to have the genetic predisposition. One of the advantages of modern technology is if you identify a cancer gene that predisposes you to cancer, or that one person, then you can develop probes to that mutation, and it becomes much cheaper to screen the rest of the family. So instead of everyone running out and getting, full-blown, next generation gene sequencing, it's best to do that on the highest risk person or the youngest person. You'll see on the internet 23andMe and other gene sequencing websites. You should know that the technology they're using are SNPs. They look for polymorphisms, and then they go to their library and see what other people had these same gene mutations, and then they can extrapolate what associations there were. They are not doing medical level gene sequencing. So when your doctor says you need to do molecular studies and next generation gene sequencing, that is a much more technically difficult and a much more sensitive and accurate way to find cancer genes.
How long does it take to develop lung cancer, and from that point to metastasize?
So that's an unknown, because it's going to vary amongst the individuals. There have been gene mutations identified that protect people against lung cancer. And there was a case I came across in the literature decades ago where this 90-year-old woman who smoked 2 packs a day, she had terrible emphysema, but she never got lung cancer. And they found a gene mutation that protected her from lung cancer. There are others that are predisposed. There's a mutation on the short arm of the 17th chromosome called TP53 that if you have that and you are, and you're a smoker, then you're going to develop cancer early. It's going to metastasize quickly, and your survival will be shorter compared to those that don't have the mutation. Commonly now, all lung cancers, at least adenocancers and squamous cancers, are having molecular testing because there are now treatments that are available for certain gene mutations. And if we find those, they're better than the old-fashioned chemotherapies that cause hair loss and low blood counts and those complications.
What are your thoughts on black human seed? I don't know if that's effective. And
I believe what you're referring to is black pepper and turmeric, or are you talking about cumin seed?
Yep.
So the problem with many of these compounds, they go in and out like fads. Turmeric I'm more familiar with than cumin. The problem with all of these is there's very little research. Most of the research that you'll see on the internet are testimonials, and you don't know the details of that person that's giving the testimony. They'll say, oh, cumin fixes this disease, and I put it in the category of snake oil. Perhaps there's something there. Turmeric, there are some experiments in the laboratory that look very interesting, and I know a researcher at Cleveland Clinic that's looking at the interaction of black pepper and turmeric as a prevention of cancer, and he's looking at how that behaves in rats, and it looks encouraging. But we've cured cancer in rats far more than we've done in humans, and so there's insufficient data to endorse that.
So the last question I see on here, how can you determine how one gets colon cancer? So I'm not sure if they're talking about screening or...
Yeah, I believe
lifestyle.
what you're talking about is how do you detect or prevent colon cancer? Since colon cancer is one of the most common cancers in the United States, there is an active screening process nationally, and the American Cancer Society has been pushing for aggressive screening for colon cancer for years. A lot of that push was last year, and it was drowned out by the COVID crisis. But screening, the current guideline is by age 50, and you should start earlier by age 40 to 45 if there are colon polyps and colon cancers in your family. But you should have a colonoscopy, or if you don't have a family history of colon cancer by age 50, you can use Cologuard, which is this stool test that's being advertised. That was developed by a researcher at Johns Hopkins, and they're looking at DNA within the stool, and it's been found that if you detect these cancerous mutations, then you can select them for colonoscopy and maybe not have to do colonoscopies on everyone. But if you have familial cancer or an excess amount of cancer in the family, then Cologuard is not appropriate because it can't detect the tiny tumors. They have to be of a certain size before they become detectable. Colonoscopy is the gold standard. We used to do lower GIs and sigmoidoscopy, which is just looking at the left side of the colon. But then what happened is the cancers got smarter and they started developing only on the right side of the colon. And so now you have to have a full exam in order to detect it. CT colonography is out there where you can do a special type of CAT scan that looks for polyps. The problem with that, in my opinion, is that if you find something, you still have to do a colonoscopy. Colonoscopy remains the gold standard because it's the only one that can get tissue and be therapeutic and actually remove the polyps. So as far as prevention, even before you do screening, the data that's out there is also controversial, but is leaning towards low-dose aspirin. Dr. Lynch, who discovered the Lynch syndrome, his son is a GI oncologist at Memorial Sloan Kettering, And he's published work that's provocative, not conclusive, that shows that aspirin may reduce the colon polyp rate and reduce colon cancer rate in those that are predisposed. So that's one thing out there. But then the downside of aspirin is it can cause stomach ulcers in many people and GI bleeding. So are you causing one problem and fixing another? As far as vegan diet, my father was a butcher. I grew up eating meat. I've tried. I can't do vegan. I'm sorry to everyone out there that's gone vegan. I will probably try again because there is something to it. But is that because of the meat in the diet, or is that because of obesity, because we're eating too much meat? And is it nitrosamines that are in processed meats? Nitrosamines were very common a few decades ago as a preservative, and they have been conclusively linked to GI cancers, gastroesophageal, and pancreas. And luckily they're banned, but that doesn't mean that you can't get them out there.
Okay, last question, I promise. Is there a role for immunotherapy for pancreatic cancer after chemo?
So there definitely is if you have one of these genetic mutations, the microsatellite instability, those for sure will be sensitive to immunotherapy. For patients that have no mutations and what we call wild type or the generic adenocarcinoma of the pancreas, because there are also islet cell cancers of the pancreas and carcinoids of the pancreas that are completely biologically different. Steve Jobs, for example, he had islet cell cancer and not the run-of-the-mill pancreas cancer, and he did herbal therapy and unfortunately waited too long because according to his book he could have had surgery up front. Anyway, I'm getting way off topic. So is immunotherapy a potential benefit? Yes, the answer is it is of potential benefit, but the probability of response is much lower than if you have MSI instability. There is a test that your oncologist can run on your tumor biopsy to help predict if it's going to be a favorable response rate or a waste of time. You can look at tumor mutational burden, again looking within the cancer cell, looking at how much of the DNA genome is mutated. That burden, if it's a high burden, those tumors tend to be more targetable and treatable with immune therapy. Again, because they're probably expressing antigens that can be targeted.
Well, thank you so much, Dr. Baer, for your time. You've been very generous in answering all these questions and a wealth of information.
You're kind. Thank you, everyone out there, and may your days be as sunny as our day today. Thank you.